For those who join a bit later, I'm Ping from Medical Channel Asia, your MC for today. In this next segment, we have set aside some time to answer some questions that were posed by some of you during the registration process. So for the first question, is high-intensive training suitable for an advanced stage breast cancer survivor?
When we say advanced stage breast cancer survivor, what is the definition of advanced stage breast cancer? If you can give me a definition, are you a patient out there who has advanced stage breast cancer? Because it's a very heterogeneous group. Advanced stage breast cancer can refer to stage 4 breast cancer with spread to the liver, bones, lung, the brain. Advanced stage breast cancer can refer to breast cancer which is spread to the bones only and is treated and is under control. So it really depends on how controlled your disease is. If your disease is under control and your specialist has told you is under control, you're still undergoing treatment, not in the form of chemotherapy, but maybe simple tablets, and you're physically fit, there's no reason why you can't undergo high intensive training, right? However, if your doctor says that you're probably not suitable because your tablets have made your bones weaker, if you do high intensive training, then the risk of fractures may be higher, then can't. It really depends on what kind of cancer you have or the patient has. Yeah,
that's a very good answer. Okay, so next question. How accurate is a biopsy result?
Yeah, okay, so when we say biopsy, basically it means we're taking a tissue sample from the lump. Now it depends on what type of biopsies are done, firstly. So biopsy is a very generic term. So some people do, I'm speaking for the whole of Asia, sometimes they do a cytology. That means they put in a little needle, which is the same as your blood test needle, and they take little cells from the tumor. Now that one, the sensitivity of that test is not very high. So that may result in a false negative. That means it may be cancer, but it says that isn't. So the accuracy of that is not as high. That's about, maybe it's about 60%. Now, on the other hand, if you do a core biopsy, that means you put a needle inside, a big needle, which actually cuts part of the tissue out. You have a little worm coming out, 2 centimeters worm. That means a good portion or representation of the lump. That is probably more accurate. The most accurate, of course, for example, very tiny lumps, let's say we're talking about 8 millimeter tumors, you may have to take the whole tumor out to test. So that's called a mammogram biopsy. So the accuracy of the biopsy result depends on the type of biopsy that was done. Yeah, and sometimes it's not conclusive, especially when there's it does not come back as cancer, outright cancer, but it says abnormal cells, because sometimes cancer cells in a tumor may be very little, maybe it's only on the periphery, like an orange, maybe it's on the skin, whereas the inside may be normal cells. So the doctor has to make the call based on the imaging, whether the biopsy is representative of it or not. So that's why we need to look at the whole picture.
I see. So in that case, there may be circumstances where there might be repeated tests that will be done as well.
Yes,
correct?
Absolutely right. Absolutely right. Yeah.
Okay, understood. Okay, next question that we have. Does one's diet play a part in whether you are more likely to get cancer, or is it stress or hereditary?
Yeah, I think I alluded, I spoke about this in the talk. So a BMI of more than 25 is BMI more than 25 definitely has a high risk of getting breast cancer. This was found in one of the data in a local paper in Singapore. And in generally, obesity is associated with any type of cancer. In breast especially, because obesity tends to stimulate or produce what we call the estrogen and the progesterone receptor hormones in the body. These are the female hormones which you don't want in excess, so-called excess, inverted commas, as in you don't want it in excess to stimulate any cells growth. So that's what happens in obesity. That's one of the reasons why. Second reason is because obesity can induce you to have other medical problems like diabetes, high cholesterol and all that, which, diabetes itself, poses you at a lower immunity state, and that in the long run poses as a risk factor for cancer because decreased immune status. So yes, so it does. And alcohol, as I said, alcohol refers to, so women are advised to take only about 2 glasses of red wine a week, actually. I know a lot of ladies nowadays take more, but that's the data. So more than that is considered, too much, unfortunately. Other than that, I think, yeah. Then, I mean, there's some patients who go the extreme end of, going on organic diet and all that. I mean, I suppose once you get cancer, I guess you want to take all means for not to have the cancer coming back again. It's fine, but sometimes I find that itself is like a stress to the patient. I have to eat this, I can't eat this, I can't eat that. I mean, don't focus so much on the physical aspect. So yes, stress, you see, that's a stress itself, and a lot of people forget that when you're talking about healthy living, we're also talking not just the body but the mind as well. You must have a healthy mind in order to be healthy. So don't get stressed and bogged down with so many things. And we find that a lot of so-called healthy women with breast cancer, we can't find anything, but we do find the most common feature is that they're all stressed in between. So, take a break, take a break. The hereditary part, I think I've mentioned it quite a number of times. So
yeah, understood. Very valuable advice there about managing your stress levels in like possibly all aspects of life, actually.
yeah, exactly.
Yeah, correct. Okay, so I believe we have just these 3 questions because some of them were already answered previously during your presentation, as I mentioned earlier. But we have many more questions actually coming through the Q&A box, correct? Okay, so let's go on to the first question that we have for tonight from a participant called Paris Chu. If I am young, how often should I go for breast cancer screening?
So I would say the definition of young would be less than 40 years. Okay. If you're less than 40 years, so most of the screening protocol is, if you see the screening protocol is usually catered to above 40 years old. But, ironically, I did mention in my talk that about, 15-20% occur in young patients. So you can, it also depends on your family history. Is there a family history of breast cancer in your family? If there's a high incidence, for example, mother, auntie, cousins are all having breast cancer, then the chance of probably having the cancer gene is high. So you may want to start screening at a younger age. Normally we advise 10 years younger than the relative who had the cancer. Let's say mommy had the cancer at 45. Then the daughter should start screening at age of 35. If mommy had the cancer age of 35, then daughter should start screening when she's 25. The screening that you should get is less than 40 because the breast is very dense. There's no benefit of doing a mammogram, number one. Number two, we don't want to unnecessarily do mammogram in younger patients and subject them to the radiation. Of course, there's a risk benefit. So that's why we only advocate it for above 40. So, but you're welcome to do ultrasound of the breast. You can do it yearly, you can do it once in 2 years, depending on the finding of the initial ultrasound.
That's really great advice, quite specific as well. So what activities should be avoided by those who had chemo done a year ago?
What activities?
What activities should be avoided for those who had chemotherapy done around a year ago?
It really depends on your current fitness level, right? So there are a lot of patients who, if the chemotherapy is done, they move on with life. They don't have any crippling side effects or anything. They actually carry on with life. So it really depends on your current physical state. If your current physical state allows you to do exercises, you should do it. There's nothing to stop you. You should go out. I mean, minus the COVID situation now. I have to add that in. So there's nothing that can stop you from doing all that. But if you have some problems, for some people get heart issues after chemo, very rare, but they do. So it really depends. It's good to ask your specialist.
Great. Okay, I think this is a very, very popular question actually. Can men get breast cancer?
Oh yes, they can. But it's very, very rare. Only 1% of breast cancers occur in men. So that's why it's not worth to screen it, because we screen something which is most common. There's no point screening when 1% get, and then screen everybody when it's normal. So it doesn't make sense. But it's good for men to know if you find a lump, basically a lump anywhere in the body is not normal. If you find a lump in the breast or there's a discharge from the nipple, get it checked. And the treatment is the same in women, actually. There's no difference.
Interesting. Okay. So another question from an anonymous attendee: when is the best time to physically examine the breast, before or after a menstrual period?
Yeah. So the best time is actually after, because before, as most of you would have experienced, the breast gets a bit like gorgeous, like breastfeeding, a bit sore, a bit swollen, the bra feels a bit tight. So everything inside the breast will be a bit more edematous, everything may feel like a lump. So we don't want that. That's the exertion of the hormones on the breast. So we want that factor to go away, which is 1 week after the menses. So 7 days after the menstrual flow, that's a good time to check. 7 to 14 days.
Okay, thanks. I think that leads into the next question. Actually, somebody asked if is it normal to feel pain on both breasts before menstruation, and I guess that
yeah. So it's the same, it's the same hormones acting up. Yeah. Of course, there are some women are very fortunate they don't get the pain, but some women get it. We don't know why. It's just as good as why some women at 35 still get pimples on the face. So these are, the hormonal effects on each individual body. We can't tell why some people get pain, some people do. Yeah, but it's nothing harmful generally.
Okay. Somebody asked as well, I wake up and I found that I have a lump in my breast and it's kind of hard. Is it a sign of breast cancer?
I don't know. It can be a benign lump. You better get it checked.
Okay.
Don't wait. Don't wait for 2 months, 3 months. Get it checked today, tomorrow.
Okay, great. Yeah, and I also appreciated the advice previously about finding the correct specialist to actually get it checked as well. Okay, another question would be, when I sleep, can I lie on the side where I had the mastectomy?
Yeah, sure. If there's no complications on that side, some people get some scarring which causes pain and all that. But if there's no complication whatsoever, it's fine. Yeah, no problem.
Okay.
We're talking about months. We're talking about months after the mastectomy. You're not talking about immediately after the mastectomy, I presume.
I believe so too. Yeah. Okay. Next question would be, what's the risk for a single lady subjected to breast cancer? Because you were talking about all the mitigating factors that can prevent breast cancer, like what you mentioned earlier. So what's the increased risk for a single lady to have breast cancer?
I don't know what this question means, but the incidence is in Asia is about 1 in 13 women have breast cancer from the age of 40 to 75.
I see.
So the lifetime risk is about 1 in 14.
Interesting. Okay.
This used to be 1 in 10 just 5 years ago.
Oh, okay. So technically it's rising in that case.
No, it's rising.
Oh, yeah, it's rising.
Right. Sorry, it's the other way around. Sorry, yeah. Thanks for highlighting that. So it's actually 1 in 14 5 years ago, and now it's about 1 in 11. Yeah.
Do you think there might be any reasons for this increase in incidence?
One could be the incidence could be more because of the awareness of women. The women nowadays are more aware to screen or get checked. There's a problem compared to three decades ago. That would be one. Two would be a more westernized lifestyle, more sedentary. I forgot to mention exercise definitely helps reducing the risk of cancer. So everyone is, glued into Zoom, sitting down and, work from home, do stretch out, do walk, at least about 35 minutes of exercise 3 times a week has been shown to have some benefit to protect against cancer. So a sedentary lifestyle plus the diet, plus the stress. So all that probably has contributed.
Understood. Yeah, very valuable advice for everybody to take note of. Yeah, I think even apart from breast cancer, I believe exercise can also help with many other
So many
lifestyle
medical.
diseases.
Exactly,
Yeah,
exactly.
correct. Okay, we have another question. For about 2 weeks, I was having breast pain. Upon ultrasound, the sonologist found that I have many small breast cysts. Are these the ones causing pain? How can this pain be alleviated?
Yeah, so this is a very common presentation in the breast clinic. Yeah. So again, I suppose you're very distressed about the pain naturally. Like I said, the reason for the pain is usually because of the female hormones acting up. We don't really know why. It can be not associated premenstrual. It can be any time of month also. Usually very tiny cysts do not cause the pain. Premenstrual, some of the cysts can swell up a bit and exacerbate the pain together with the pain which is already existing from the hormonal effects on the whole breast. So it creates a double whammy. Yeah, but removing the cyst is not going to get rid of the pain though. So that's one thing I need to mention. Yeah, because the underlying cause of the pain is not exactly this.
Interesting. Okay, next question then. Is breast ultrasound necessary apart from mammogram?
So it depends on what context we're talking about. If you're talking about breast screening in general, that means we are talking about the general population with no symptoms whatsoever. You go for, I want to screen because I just want to check, then mammogram is adequate. Now, once you have a problem, as in you have a symptom, you have a lump in the breast, you have some nipple discharge or something, or even pain, or some distortion or something like that, means there's a sign. And there's a sign the mammogram is not adequate, right? Because we may be dealing with underlying problem. And if you remember my slide, which said that mammogram can miss 8 to 10% of cancers. So that's the reason why if there's a problem, please do not go to the screening center and do a mammogram, because the mammogram may come back as normal. And then you will tell yourself, hey, there's a funny lump, but mammogram normal, I should be fine. No, you're not fine, right? You have to get it checked by the specialist. We have to do an ultrasound breast. Sometimes you may have to do MRI. I don't know. So mammogram is just a starting point of screening, right? So it really depends. So for basic screening, mammogram is adequate. If the breasts are dense, like in the US and all, when patients have dense breast refers to basically a physical characteristic that we see on mammogram. It means the breast is like very thick, so-called very opaque. So when it's very opaque on the X-ray, we can't see things beyond the opacity, you see. There may be things behind, but it's missed. So when the breast is dense in women, which you only know after doing a mammogram, then the specialist will advise an ultrasound as well. And it's mandatory in the US, but in Asia, I think it's not mandated yet. But a lot of breast specialists, if they find that the patients for screening have dense breasts, will recommend an ultrasound as well.
Great. Thanks for the answer for that. Okay, we have a question from William. His question is actually, can someone with stage 2 breast cancer undergoing treatment suddenly advance to a breast cancer stage 4? Is that possible? Undergoing treatment.
I guess it depends on whether she was fully evaluated before treatment was started. That's one I would query. So sometimes before treatment is initiated, usually here, it's quite comprehensive. I can speak for me and my colleagues, but we do know in some centers, they do not do the staging scans. That means they don't do the whole body scan before treatment is initiated for some reason or other. So in which case, you might assume that it was a small tumor, but maybe it was there already, just that it wasn't evaluated. That could be one reason why in the middle of treatment, suddenly it has progressed. That's one reason. Second reason why is that maybe you may have to question whether there was any issues with the treatment at all. Very that. Otherwise, it's a bit unusual.
Understood. Okay, next question will be about treatment as well. Are breast lumps possible to be treated through taking some pills?
No, unfortunately not. You'll be a Nobel Prize winner if you do that. Unfortunately,
Okay.
there's no. That's why you see the breast surgeon.
Understood, understood. That's right, that's right. Okay, another question would be, I have no lump, but I feel pain underneath my breast that connects to my back, and it feels hot every time it occurs. Any explanation for this or any recommendation from you?
I think generally this one is a heavy-breasted women. I'm not sure if you are. So probably the weight of the breast causes a lot of skin problems below the breast. You know, around moisture, around skin, like fungal infections can be happening. The weight of the breast can cause back pain if you're heavy-breasted. That's one of the physical possibility. If you're not in this category, then you know, it's probably related to stress, or it can be related to nothing to do with the breast, probably muscle and skin problems.
That's a good answer as well. I hope that helps the person who asked this question. So next for Tan B. Lian, I am 56. I had both breast lumps benign removed 20 years ago. 3 years ago, there was calcium found on the left breast. She said that she already stopped her review. How often do you recommend that she actually does a checkup?
So it depends on 3 years ago, what kind of calcifications they found in the breast. So the calcifications in the mammogram, 80% of them are benign, 20% are not. So once someone has calcifications, we generally tend to follow up to see if there's a change in the pattern every year. And if we follow up for about 1 to 2 years, we find that there's no change. It really depends on the type of calcium. So it's too generic to tell me calcium. So it really depends on the pattern. So if the pattern remains stable, we call it stable, then it's probably normal. But you do know that the advisory for above 50 is a 2-yearly mammogram. So the answer is you have to go for the screening. So 2-yearly screening, you should get it checked because it's 3 years already. You should get it checked, make sure that it's stable. And then if it's stable, you can do it depending, you got to ask the specialist for advice. Is it 2-yearly or yearly?
Yeah, understood. So it should be good to get some advice, at least just go for a check and then get advice from that particular physician as well on the recommendations thereafter based on that check.
Yeah.
Okay. I think we will do maybe 1 or 2 more questions. One of them from Jenny, does pain in the bone under the breast a sign of breast cancer?
Usually not. Usually is what we call a costochondritis. So if you're referring to tenderness, that means when you press very deep in and you have a little bit of, you know, soreness down there. Most of the time is because of what we call costochondritis. That means the rib bone is inflamed. But this should resolve, you know, it shouldn't be there like all the time. Generally, it takes about a month or 2 to settle down. If it doesn't settle down in 2 months, you have to get it checked.
Okay. Okay, I think let's just do 1 more question. I think that just came in a bit earlier. If the breast discharges whitish and bloody fluid, what does it mean?
Whitish and?
Bloody.
Oh, it means you have to get it checked. I can't answer this question. Not safe to leave it alone. That's what I can tell you. It's not safe to leave it alone. You must get it assessed. You have to see a breast specialist, right? Get it assessed.
Yeah.
Don't go to the screening center and do a mammogram and come home, yeah? Please see the breast specialist.
Understood, understood. Okay, yes. So I hope that that's all for the questions that we have for tonight. I hope that the questions that have been answered by Dr. Radhika has been beneficial for those who have actually asked their questions, and I hope that everyone who didn't ask their questions as well learned something during this session. So thank you everybody for such an engaging session. I myself have learned a lot of new tips, new myths, what to say when somebody says, oh no, you shouldn't do this or you shouldn't do that about breast cancer. Okay, so there are still many good questions that are unfortunately unable to answer due to the lack of time. However, not to worry, we will be collating these questions and answering them with the help of Dr. Radhika, and we will be posting it on our website in time to come. So do follow our Facebook page to keep yourselves updated. And right before we end, we have yet another poll to fill in on this event's quality, and also a very important question at the end for if you would like to arrange for a more personalized consultation with Dr. Radhika herself. So maybe we'll just give you a few moments to answer the poll questions. And yes, for those who have benefited from the webinar tonight, maybe you can just say thank you or say a note in the chat just to end off the session while everyone else votes. So as I mentioned, we will be putting all these questions which have been answered by Dr. Radhika and releasing them as videos as well on the Medical Channel Asia's social pages and YouTube page. So if you have not subscribed to them, do so now. Also, do keep a lookout for our post-event email that will be prompting you to subscribe to our YouTube page to stay updated about this as well. And before we all go, do click on our MCA channels, for example, Facebook, YouTube, and Instagram for our latest updates on the subsequent Doctor on Call event and webinars. In fact, we actually have one more webinar happening next Tuesday night. So that's actually the last of our cardiology series, or the series related to our heart. So next Tuesday, we have a doctor that will be coming in to talk about ischemic heart disease, like heart attacks, and how COVID-19 actually affects our hearts. So if you are interested, you can head over to the chat box to just click the link to sign up, and we'll see you next week. So thank you everyone for attending, and thank you Dr. Radhika once again for spending your precious weekday night with us to share all your valuable nuggets of information. Thank you everyone for attending, and may everyone have a good night.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.